Very warm welcome from all the Present Initiative and all the speakers. My name is Benjamin Roche. I'm a research director at IAD in Montpellier, France. But I'm here on the behalf of the Present Initiative, along with my colleague Marisa Per from CIRAD. And so just to start this session, a few words about the Present Initiative, which is an initiative launched by the French president almost 2 years ago, which is really about co-designing One Health prevention strategies. So today we have 14 governments and 170 institutions who are members of this initiative, which has a first funding from the government of France of 60 million euros. So of course, we know there are many other initiatives with all their specificities, like the International Alliance for Wildlife Trade, Zodiac, Preventing Pandemic at the Source, just to name a few. So since this question about zoonosis prevention is a shared goal with many different actors, decision makers, and stakeholders, we are very proud to host this session to exchange our views and our experience on this important topic. So may I have the slide, please? Does it work? It's coming. That's perfect. Thank you. So yes, just to start, a very quick introduction, just to give a bit of context. Sorry. So since we know that since at least 4 decades now, we see that the number of emerging infections is increasing dramatically through the world. So we record today 4 times more outbreaks than 40 years ago. Of course, detection capacity have hopefully improved, but the trend is here and it's very clear. So for a long time, we were thinking that we will be ever fast enough to control these emergencies before they turn into global pandemic. But human connectivity has also changed a lot. And a small cluster somewhere can become a global threat in several weeks, very quickly, as we are experiencing since now a couple of years. So if the trends are remaining stable, we definitely have all the ingredients to observe new pandemic in the next years. So of course, we need to be better prepared to this threat and deploy control measures as quickly as possible. But we also need to combine that approach with a preventive one. And to do so, we have to understand what are these emerging infections and why they are actually occurring. And so when we look at this emerging infection, it's very clear that the vast majority of them are actually zoonoses, meaning that pathogens that are spilling over from animals to humans. And the core factors are now well identified: a strong human impact on our ecosystems that increase microbe circulation and disturb this interface between animal and human, such as climate change. So zoonosis emergence is another manifestation of our impact on Earth. So therefore, this is why it's really crucial, in addition to a better preparedness, to develop primary prevention, so namely reducing this kind of spillover. It means that we have to monitor better this interface between animals and humans to control this first localized transmission event when they occur, but also envisioning strategies of ecosystem management that are able to decrease spillover likelihood. Importantly, if we want these strategies to be implemented on the ground, we also need to engage with all the different stakeholders, decision makers, and actors. So preventing zoonosis emergence through a One Health approach, from fundamental research to operational actions through the development of public policies, is what we are going to talk about in this session. So to start, I just want to introduce each of our speakers. As you can see, we have a very impressive lineup of speakers today. So we just sit down now. You can remove the slide. And so I will start by introducing Dr. Najat Mokhtar from the International Agency for Atomic Energy. So you're the Deputy Director General of this agency. So Dr. Mokhtar, when you hear people talking about your agency, of course, they think about your agency as a nuclear watchdog, but they don't know that your agency is actually working on the reinforcement of veterinary capacity since almost 60 years. Yeah. So what are you thinking about that?
Well, thank you for the question, and good afternoon, everybody. Indeed, I think most of you are asking why IAEA is here. We are not talking about the war in Ukraine or the or Iran, but we have also, but I think, as you have rightly said, 60 years we have joint program with FAO. And we are tackling food security, including animal health, as I always say, from the farm to the fork. And we have an animal health section together with FAO, where we're tackling zoonotic disease for over 60 years, helping member states, helping countries. We have 174 member states. And what we do, we are field agency, we're technical agency. We go down to the field, we build capabilities, we equip labs, and we train staff. This is what we do. We are not policy agency, but we are more out there in the field to make sure that the information given by the veterinary laboratories are correct, and they will help informative decision. Shall I stop here?
That's perfect. Thanks for keeping on time. So our next speaker is Dr. Andrea Winkler, so co-director of the Center for Global Health at the Technical University of Munich. She's also the co-chair of the Lancet One Health Commission. So Andrea, since you are the co-chair of this Lancet One Health Commission, and therefore so having a significant experience about connecting the One Health approach with a very large range of societal issues. So how would you define your mantra about this approach of One Health?
Well, thank you very much, Benjamin, and of course also Marisa and Prisold for the kind invitation to this panel. So in the Lancet One Health Commission, we try to collect evidence, and there is more or less evidence on specific topics. To evidence that supports a One Health approach. And I would like to make clear from the beginning, it's not a discipline, it's an approach. It's all about integration. So One Health is going to be integrating specific sectors, disciplines to converge on one specific topic, like, let's say, prevention of pandemics at source, just as an example. So my mantra is that we really, or the mantra also of the Lancet Commission is that collaboration and coordination, communication across sectors, but also across disciplines, and with the communities really at the core. So to bring in the local communities from the start, meaning co-designing, co-advancing, co-promoting, and also co-reaping benefits. In addition, we have an ethos. The ethos of One Health is really equity in all approaches, but also holism and a systems approach. And there's more, but we don't have that much time. And then, of course, all of this needs to be embedded in a favorable environment. And this now is the key word here, is implementation, because we have talked a lot about concepts. And so now how can we create impact, and how can we implement? For that, we need enabling structures, enabling One Health structures, but also frameworks, action plans. Today, the One Health Joint Plan of Action from the quadripartite, WHO, the World Organization for Animals, FAO, and UNEP has been launched. It's today, so it's a memorable day. And then we definitely need One Health leadership. So that is my personal mantra, but also the mantra of the Commission, I guess. Thank you.
Great. Thanks, Andrea. So our next speaker is Dr. Anna Bento. So you're the science director at the Pandemic Prevention Initiative, supported by the Rockefeller Foundation. So how would you see this translation of the academic science you are developing to concrete operational actions?
So that's actually a really good question, Benjamin. So at Rockefeller, we really have an initiative that is science-based, but it's science that meets needs. We are creating and co-creating initiatives with partners that have very specific asks. And so we're developing new methods and highlighting and harnessing parallel data streams that are effective use of data, effective use of new methods that can actually bridge governance, skill, and the knowledge gaps. So it's really translational science that is always asking for a proper need given the country.
Great, thanks, Anna. So our next speaker is Benoît Meribel. So Benoît, you have been deeply involved in different foundations, and since a couple of years now, you are the Secretary General of the One Sustainable Health for All Foundation that you have also created. So can you explain us also a little bit how you will see the implication of the civil society toward this goal of zoonosis prevention?
Yes, as we know, prevention is a key issue. We see that, as you reminded, 75% coming from zoonotic emerging disease. The animals, we are close to them and they are friends, but they can bring us pathogens. It goes with diagnosis, because without diagnostics, medicine is blind, of course, but it goes with the involvement. And it's one of the lessons learned during the COVID-19 that we need everyone. We have in mind vaccines, medical tests, rapid tests that are stuck in everywhere in Africa, in Asia, because they don't know how to use it. People are not trained. We are short of human resources. So we decided to create a forum, one sustainable health forum, and you are part of it. You, Prezod, IRD, Andrea, and it's an inclusive forum to share together this, priorities. And the forum for the moment has 6 international working groups. And we have also, in addition to that, discussion on the policies issues with One Europe for Global Health. I just come from a session. It means that Europe is now working on a global health strategy, and we need to see One Health integrated on that. So it's the second aspect of the forum, and the third one is just to develop it because we want it to be inclusive. We believe that all the civil society, I would say professional, has its place to bring, as part of the solution. We have seen that from this COVID-19, nobody was protected. Everyone could be, hit by what, and so everyone has a part of the solution, by the way. So we need to raise awareness with, of course, local communities, etc. So it's part of the challenge to make a success of what you are providing with Prezod, and this challenge of keeping the animals as friends first, but being able to manage to the surveillance goes with many tools that but partly we bring this with this forum capacity, understanding of that. We had seen with the 2 decades ago with HIV, sorry, that's very important to explain. So this takes time, and we need to rely on the civil society.
Great, thanks, Benoît. And so last but of course not least, Professor Wanda Marcotter, who should be on Zoom. I hope you can hear us, Wanda.
I can. I hope you can hear me and see me.
I think that's the person on Zoom. If you can put her on the screen. It looks she's online. You're online. Here you are. Yes. Can you? Yes, perfect. So Wanda, so you Professor at the University of Pretoria, you're also the co-chair of the One Health high-level expert panel from the quadripartite. So can you share with us how you see the scientific work of the academic community and the required coordination to improve operational action on the ground? So how the OLEP actually is advising the quadripartite on this topic, and how you see your role at the OLEP to this extent?
Thank you, and my apologies for not being able to be there in person, but thank you for the invitation. So I want to go back a little bit to our understanding of prevention, because that's the discussion that we have today. And Benjamin showed that there's going to be more outbreaks. We know that there's an increase in life loss and economic costs, and some of us might argue that it's better to looking at future pandemics just to detect and contain emerging zoonoses after we detect the first human diseases. But I think if we really talk about prevention, and I want to come back to what we understand from my perspective in terms of prevention, it's really to include the identification of drivers of spillover and how to reduce that likelihood and consequence of spillover from happening in the first place. So it's really on that prevention first action, which is not just about pathogens, it's really about drivers. So coming back to the advice to OLAP, if you look at this interface, One Health is integral. You cannot talk about prevention without having a One Health approach. And one of the first things we decided is that we need to have the same understanding of One Health. So we started out from a One Health definition that we published recently, and that's endorsed by the quadripartite. And a lot of the activities going forward is really based on that principle. And I will say some more on that today and some of the activities. But it's really about science-based advice. And for some of these things, we don't have the science, but then we need to recognize that. And we need to make sure that going forward, we're going to collect scientific evidence. So there's really, again, that role that everybody needs to play. All stakeholders need to be involved. And we just spoke about society also. But to get the correct information on the table, to be able to make decisions to try and prevent pandemics going forward is really essential. Thank you.
Great, thanks, Wanda. So now that all the speakers have been introduced, so can we go back to the slide, please? I promise that's the last time I'm asking for the slide. It looks complicated. Yes, that's perfect. Thank you. So yeah, I put all the slide, but it was a bit complicated. Here we are. So, so just to explain it a bit how we have organized this session. So we try to organize the discussion through 5 different changes, which looks important for this topic of zoonosis prevention. So the first challenge is exactly what Wanda was talking about, is about understanding the zoonotic risk and risk activities that increase the likelihood of having a zoonosis emergence. Second challenge will be about how we can reduce this risk, especially through the co-design of this solution. The third challenge will be about how can we make stronger these early warning systems at this interface between animal, environmental, and human health. The fourth challenge, which may look a bit technical, but which is, I think, extremely important, is how we can make all this data interoperable between them. And finally, the last challenge is how we can engage all the different stakeholders and how we can co-design these One Health networks and policies. So you can remove the slide now that I explained my thing. So we will start with the first challenge, which is really about understanding the zoonotic risk and risk activity. So I go back to you, Wanda. So zoonosis emergence, as we all know, is a very complex process. So to your opinion, what are the key steps in this emergence process, and how do you think we should approach the understanding of these factors?
Thank you. So I think, yes, it can be complex, and it's definitely not the same factors that drives disease emergence in every area of the world. And we need to recognize that firstly, we need data that's in context and in the geographical region that's relevant to that specific region. We can't extrapolate something from another region, and it can even be community specific. So it's really being on the ground and understanding these factors. And I think what we need to recognize, and a lot of what we've done in the past have been so focused on just identifying diversity of pathogens. So we were just testing animal species to see what's in them, and we would report on that. But on the other hand, we didn't, in collaboration with that, really look at the drivers at the same time. And the drivers is where everybody say it's complex, because what do you look at? You know, but we need to, if we want to go forward and we really want to prevent, it's essential that we really look at that interface between animals, humans, and the environment. And it's not just about animals and not just about humans. The environment is also really important. And although we can look at things like anthropogenic pressures, we can look at deforestation. In some cases, it's bushmeat. In some cases, some of the markets. It can even be climate change, and it won't be the same everywhere. So we really need to try and understand what is important in a certain context, and then really include all of this. I think one of the things that we're really not looking at carefully is human behavior, because you can have a risk, but if there's no contact, what is the risk? You know, if there's pathogens in nature and nobody has a contact interface, no other animal or humans, it's not going to spill over. So it's really looking at that interface where spillover can happen. Yes, we need to understand the diversity of pathogens. We need to understand a little bit about all the new things out there. But we also, with that same intensity and effort, needs to look at the drivers of disease emergence in specific areas where it may be critical to understand that in the local context.
Great, thanks, Wanda. So a question for you, Andrea. So we know that such emergence may involve so many different disciplines because, of course, different entities have to be studied, so animals, environment, humans, and so on and so forth. So how can we develop a real interdisciplinarity and not doing some kind of interdisciplinarity washing to understand this factor that really require this kind of interdisciplinarity?
Yeah. No, thank you, Benjamin. I think that's a very important question, and true interdisciplinarity. So we're not talking about multidisciplinarity because that is basically get together, talk, and then leave, and that's it. I'm exaggerating, but interdisciplinarity starts with listening. That's what I would say. Listen and understand what the other person and the other discipline is all about. And then the next step would be engaging and respecting the approaches that the other discipline has developed over so many hundreds of years, most likely. And it happened to me that I only realized months and even years ago what the other discipline really is about. So, for example, we work a lot with IT specialists. We work a lot with social scientists. I'm from biomedicine, so I'm a neurologist by training. Of course, we're also in our own field. We work with public health experts, immunologists, infectious disease experts, also, of course, non-communicable disease experts, and you name it. But to understand the discipline and also the approach within, let's say, academia and how people work, it takes a lot of time. And it takes really meetings with good listening. And also, and this is just what I repeat occasionally, is you haven't worked truly interdisciplinarily if you haven't felt the pain. It can be very painful because you just need to leave behind what you think is right. And then on top of that, that's only interdisciplinarity, right? So let's move to transdisciplinarity when you really engage with the people and their communities, so also animals and the environment that matter, especially for disease or infection prevention, pandemic prevention. Then you really need to leave behind everything you were taught and engage with them in a totally different methodological approach. So this is, maybe I stop here, but this is also something that needs to be taught. It doesn't come overnight. And I would also advocate for our young people that this is included into curricula in a theoretical and practical way. Thank you.
Great. Thanks, Andrea. So before moving forward, I forgot to mention that if there are any questions from the audience, please raise your hand. That's the same on the Zoom. You can for people who are following us online. So if there is any question from the audience now before we move forward, I think it should be okay. Okay, I'm moving forward to the next challenge because, of course, we're running late, but it was expected. So the second challenge will be really linked about how we can reduce this risk of zoonosis emergence. So we know that we need to understand this zoonotic disease system. We know that we need to translate the academic knowledge we are producing into operational activities and to public policies. But now, what are the main barriers, obstacles about implementing this risk reduction? So my first question, I go back to you, Wanda. So there are very different ways to develop and implement prevention strategies against zoonosis emergence, from reducing microbe circulation inside the ecosystem until the beginning of the human-human transmission. So how would you see reducing this risk inside the animal compartment? What do you think about mitigating pathogen circulation inside the ecosystem as a potential way to prevent zoonotic disease emergence?
Thank you. Yeah, so I think that's a difficult one. If we talk about pathogens in this nature environment that we call reservoirs, where the pathogens have always been there. They don't make these animals sick. They've adapted. But the problem is if they spill over to other animals and humans. So we can't get rid. I mean, we can't go out and kill every bat or kill every rodent to get rid of pathogens. That's impossible. We can't get rid of this pool of diversity that we will have in nature. It's really about that driver. What is causing that animal to have contact with another animal or humans and making that pathogen spill over? So it can be land use changes that bring animals into contact with different species. It can be human behavior where we look at maybe people slaughtering animals or using it for other purposes. We immediately have contact with blood and other body fluids, which is high risk. It may be the way that we put our food on the table. There's just so many issues. So we need to acknowledge that those pathogens will always be there. But we really need to look at what is that interface. And we'll probably not prevent every single spillover or every single driver. But if we reduce it to a certain amount, that is already winning. And that is already going to prevent and save a lot of lives and a lot of costs going forward. So we really, a lot of times we're just looking at this is the driver. It's land use, it's wet markets. We're just listing them, but we're not really looking at interventions on those interfaces. And I think we need to do a lot of work on what the intervention should be. And that goes back to some of the previous comments from speakers, where communities, society need to be part of that conversation, because otherwise we will not have solutions that's actually going to be practical and taken up by communities where people are most affected by some of these decisions. Thank you.
Thanks, Wanda. So another also key point is now the increasing implication of veterinary labs into these prevention strategies, and who were maybe not, how can I say, ready to have such an importance regarding zoonosis emergence. So Najat, your agency is particularly involved in the reinforcement of this veterinary lab. So do you think that there are some key aspects that are still missing today? What are your thoughts about how we can improve the capacity of vet lab to?
Yeah, thank you. It's interesting now that we hear that the COVID-19 pandemic taught us many lessons. The first one we hear also in this panel, multidisciplinarity and learning from each other and sharing the information and involving the community, as Wanda had just said. Also we need science, we need data. And veterinary labs is there where you need the information on what's going on in animal health. And in veterinary labs before, they were underfunded. Nobody cares about veterinary lab because we all focused on human health. And just COVID-19 taught us where we need to care about the environment. We need to look at what's going on around and where COVID-19 is coming from animal. Then we start looking, okay, how we can, we realize that, you know, it's not the last pandemic. Others are coming. Monkeypox are here in Europe, and we are also learning that there is not anymore advanced and less advanced countries. It's global. We are all in the same boat. So it's better that all of us globally, we should bring these labs at certain levels, the veterinary labs. We should bring the knowledge everywhere, that we can involve everybody. We involve communities, we involve developed and developing countries in looking on what is coming and be ready. And when COVID-19 hit us, you know, 130 countries came to the agency, to the IAEA, asking for help. Because they were used to work with us, we said, well, hey, we don't have anything in the labs, can you help us? We did that, but we start saying, if they are asking us, we are not funding agency, we just can provide little help. Then we said, okay, then we need sustainability. And for that, that's why we launched this initiative called Zodiac that you mentioned, Zoonotic Diseases Integrated Action, where we said we need first to build capabilities down there in the countries, meaning not only equipping them, but also training the staff, not train on the analytical part. We need to train them to go out in the field and see what they're going to look at. You know, I think Wanda or you, Andrea, said that we need first to know what are the diseases or the pathogens out there that they can be of threat to humans. So we need first to know. So we need to bring their capabilities. We know to be able to be proactive rather than passive. That's one thing. And the second, we need also to teach them how to sample, how to analyze, how to report, and then how to share. So we have then, through Zodiac, we built this network of laboratories. And this is what you were saying, Andres, that we need to communicate. We need to share information. So now we have almost 130 laboratories globally, all over the world, that they are in this network. Now, how to make them communicating is, now we have digitalization platforms. We need to just use or link to all what exists there and link these labs. You mentioned Prezo, other initiatives. So we need to link to each other and share information, what's going on and what are the best practices. And also train the trainers, because you can't train everybody. We need to build this capability that you can translate what you have learned to the others. And this is what we are doing. It's not enough. Alone, we can't do much. I think we need to team up. We need to work together. And we need to empower everywhere and everybody. We are all concerned. Thanks.
Great. Thank you. Thank you so much. Of course, among the panelists, if you want to react to some of our answers, please do not hesitate. So my last question will be for you, Anna. So your institute is particularly involved in detecting quickly, so the first transmission chain in humans. So that's the last step, let's say, before what we call emergence, so in human populations. So how can we include this kind of One Health approach towards improving early detection of emergence, which is right now really human focused?
So the first thing to consider is that if you are most of the time working on human focus, to recalibrate your understanding, the time zero of emergence is actually much to the left of the timeline of when things are captured in human populations. And what that means is that we need to consider, as a little bit as Wanda said, and Andrea, and of course, Najat, is this idea that things need to be treated, systems need to be treated as complex systems. And I'm not talking about it in a kind of abstract sort of way, but meaning that we need to kind of disentangle these layers. And as Wanda mentioned, this idea of understanding those interfaces between those timelines when things emerge in animal populations. What are the drivers? Are they environmental, climate, deforestation, human behavior? Trying to disentangle those. In general, I tend to translate everything into a mathematical model because it's a simple way to abstract and parameterize things in a way that are easier to understand. But it goes beyond that, right? It's this idea that there are data streams that are coming from animal surveillance, from environmental surveillance, from the point that something hits humans. And then there's a whole host of things that are related with human behavior, interventions, but it also goes all the way from developing new science, in implementation of that new science, all the way to advocacy, which is something we actually discussed this morning in a parallel session. So really thinking about what are the best data to be implemented and when, because there are data streams that are useful all throughout this timeline that starts from the emergence within animal populations in the environment, all the way to when we start reporting things in humans and when we start interventions. So not all data streams have the same use and the same timing of that use. Some expire much sooner, some come and go. So it's really trying to create new models to understand how we coordinate. It's actually beyond integration in my mind. It's a kind of coordination and a way to create new ways of harnessing these data. Because otherwise, we are never going to truly understand a system holistically. Until we actually understand that all of these events are interconnected and they're not linear. In fact, they're kind of cyclical, and there's a feedback loop between all of these, as we can see from emergence of new variants, spillover, spillbacks, and in other disease systems previously to SARS Cov2. But it really is this idea of how do you harness data that already exists, and you probably haven't really considered it before, and how you best create this dialogue that goes all the way from new science to advocacy and risk communication.
Great. Thank you so much, Anna. So we have a bit of time for one question from the audience or from the panel. If there is someone where at the bottom. I'm sorry.
Hello, my name is Nadine Ronco-Larcon. I'm from the international animal welfare organization called 4Paws. I have actually a question regarding the definition of prevention, because here in the discussion, I hear a lot also in terms of this, of the discussion surrounding the pandemic treaty, that prevention starts with surveillance. Here in this room, I guess we all agree that prevention already starts with primary prevention measures, but if there is not even a common understanding in the same building, how can we move on and form strategies in regards to prevention if there is not a common understanding on what actually prevention prevails or means? Thank you.
That's a very good and tricky question. Who want to take a...
So I think I can start. I think it's actually a good segue from the kinds of things I was discussing just now, is this idea that exactly because it depends on where in the timeline you believe prevention starts. That's the first friction in the definition. If you're thinking about prevention in human populations, then you start at a particular time point and you focus on different types of surveillance techniques, surveillance timings, and different types of populations that are targets. If you think about wildlife or livestock surveillance, then you start moving to the left, and then eventually everything piles up and becomes this very kind of parallel layered complex ecosystem. But I think that part of the discussion here today, if I may be so bold as to kind of start speaking for my colleagues here, is precisely that prevention has kind of different stages and different milestones. It's not something you start preventing in the animal population and only later on you start preventing in the human population. Is this idea that if you create a baseline, then you're more robust in actually preventing things that are yet to arrive.
I think Wanda wanted to follow up on that.
Yeah, so we had lots of conversations about this the past few weeks, also in OLAP, and I think there's definitely a need for a clear definition on prevention. I mean, we're using words like downstream, upstream, midstream, secondary, primary prevention, and all of these things are actually different. And there's a lot of discussion. There's the pandemic treaty, there's World Bank funding that all use definitions of prevention. And I think if we really want to go forward with some of these discussions and also some of these projects that we, or initiatives that we're busy discussing, we're going to have a clear definition. So OLAP is currently working on that in the panel to get something out that we believe is what the definition of prevention. And we don't really agree with all these upstream, midstream, and all these different phases. We think prevention should mean one thing. And from my personal opinion, not an OLAP opinion, we're not there yet, I really believe that prevention is where you stop spillover. And a lot of the other things that we do is actually a response and some other factors in the whole picture of preparedness towards pandemics. But that's debatable, and it is also debatable in a wide range of conversations at the moment. Thank you.
Thanks for that. Anyone wants to follow up on that?
Yeah, maybe just to add, and I'm not sure whether I understood Wanda correctly now, the environment, of course, also, and I'm sure that you have included this, the environment. So before wildlife also is just not just animals, but also plants, etc.
Yep.
Soil, air, all of this comes into it, and a very important prerequisite to be able to do all of this is really good diagnostic capacity, and also to have One Health diagnostics, so that a specific disease can be detected in animals and humans, and the test really gives you a similar, strong, sensitive and specific result. So we are just trying to do this for a neglected tropical disease, for Taeniasolium cysticercosis, and it's really not so easy to have a test that works in humans and animals, and let alone the environment, right? So, but yeah, so I think that this is a really challenges that are at the core of prevention, surveillance and prevention. Thank you.
Yes, thanks. I think now we have to move forward. Yeah. So we have a question in the chat, but which is directly linked to the next challenge. So I think we will ask this question directly in the next challenge. So the next challenge is really about, so the challenge is linked to epidemiological surveillance, and especially One Health epidemiological surveillance. So I'll start with you, Benoit. So we know that detecting this kind of emergency is, of course, extremely complicated. So we have today a lot of research on how to develop participatory approach. And so involving the civil society seems crucial, including all the different actors, population, stakeholders, decision makers, and so on and so forth. So how do you see the involvement of the civil society to this kind of surveillance, broadly speaking?
I think that to answer your question, it comes to my mind that we have seen during the lockdown that, as I said before, everybody has a responsibility for the global community. We take it into account, because it used to be the medical doctor is going to solve your problem. You're sick. It's not like this. Global health, One Health is not like this. And you see that preventing, of course, it's surveillance with data, but it's also the commitment of each of us, and it goes with local communities. It goes with public awareness. It takes time. Of course, it is advocacy to go to public policies, but that are funded on the comprehensive framework. So it's a chain of, like a puzzle of capacity. And this is why, looking back to your framework, I would be maybe in favor of having a challenge 5, which is linked to advocacy, public awareness, and policies. We had 20 years ago a brand new BSL-4 in France, and WHO international health regulation came from that. But look, after 10 years, it's so we need policies, but then we need the population. So my point is also, I think that what is new, definitely, is that we need to help this understanding that everyone has his responsibility for himself, his family, and for the village, and for the world, by the way. That it doesn't come from only research, only from the tools, it comes from us. And it goes also with this movement that that the passion between the patients and those who are bringing the care, what is the relation, We want you to be more responsible with your family, either you have diabetes or this kind of thing. So we need to integrate all the things, and this is why Andrea knows, she was talking about interdisciplinarity. The social aspect is very important. If we go back to the Ebola outbreak 2014, one of the lessons is the road that was built in the deep Guinea forest, and also the behavior, when someone dies, the tradition, etc. So we have different things to tackle. This is why it has to be a global approach and local and global somehow to be able to do so. So we have a big challenge, but I think we really know, and the specialist, that it goes with the local population. So we need to do the bridge for this comprehensive. In France, we have the mosquito tiger posters in my villages, because chikungunya is coming in France and was in Bangladesh. And some NGO take time, they go in the villages, and they are not arriving and say, okay, in case of emergency, you follow the list. No, it's not like this. They sit, they learn, they discuss. How do you see the, it takes time, but it requires investment. And we all know that preventing need money. And most of the politicians, they prefer to give money to solve a problem instead of anticipation, preparation, because it's more difficult to see, more difficult to be accountable on that. So we have a common responsibility on that point also.
Great, thanks, Bernard. I think we talk about a lot about behavior and so on and so forth. So I think we'll go back to that at some point. So Najat, so you said that during the COVID-19 pandemic, so your agency received many requests from different countries. So how would you see the role of your agency, and what will be the best architecture, let's say, of the next epidemiological surveillance system, if you can shape it as you would like to shape it? Well, based on your experience, what would be the next step towards One Health epidemiological surveillance system?
Well, as I've said, we are a technical agency, and one part is how we can contribute to this One Health. And again, we have heard data are essential, and we need information. We need data, not only animal health or animal or pathogens, where the reservoirs and pathogens displacement, and we need data. And also, again, working together, because surveillance is not only, it's complex, we have heard that. And not only looking, when we start developing the research agenda under Zodiac, and looking at what we need, we realize that you can't have a blanket approach. It has to be tailor-made to region and even to a country. So we need to make sure first that the engagement of communities, like what we have heard, but also working with other disciplines to share this information and be able that the surveillance is not only is from the environment surveillance and at animal reservoirs, animal health part, and then to the human interface. So what I want to say here is that the research agenda that has been already set. There are many there are needs there, and one of the first one is funding, and also building the capability, research capability in at country level for the surveillance, for mining, for tracing the displacement of diseases, and again we need to know what the others are doing, so that we don't duplicate, we complement each other.
Very great, thanks. So I have a last question for Wanda. Hope she's still here. She disappeared. So can you hear me, Wanda?
I see.
Yes,
you.
okay. Perfect. So Wanda, we're talking a lot about epidemiological surveillance, but we know also that this One Health approach is not just about zoonoses. It's much broader than that. So how do you think we can create synergies between pathogen surveillance and the surveillance also of other health concerns through a One Health approach?
Yeah, thank you. So I want to come back to some of the points that Andrea also made. If we talk about One Health, most of it is focused on zoonosis because of the history of all these outbreaks coming from a zoonotic origin. But I think it's extremely important that we don't forget the other things. So things that were mentioned, like sampling soil, the environment, water, maybe air. AMR is part of that picture. We can't forget that we also need to look at these things. And if we really talk about One Health surveillance, it's really about looking at pathogens in all these environments, including animals. And in animals, it needs to be livestock, it needs to be domestic animals, it needs to be wildlife. So it's not just wildlife. A lot of the things are focused on wildlife. But we also need to recognize other species. And then it is not just about the traditional surveillance systems, about looking at pathogens. It's really broadening that to bring in the drivers of disease emergence. And OLAP has just finished a product that we hope are going to be out soon, where very high level on the steps that a country can look at to look at how to implement One Health surveillance or develop a system in their country. What should be part of it? What disciplines, what actors, what stakeholders? So very high level roadmap for that. But I also want to come back to the quadripartite One Health Joint Plan of Action that actually includes all these aspects. So it's already a very good roadmap. Yes, it will be followed with an implementation plan that will be more practical. But if you go and look at the aspects, it includes AMR, it includes the environment, it includes zoonoses, it even includes endemic and neglected diseases that we shouldn't forget about. So it's really about this whole picture in One Health surveillance. And yes, it sounds complicated, but I don't think we have a choice going forward if we really want to improve. We need to start doing things different. It's not going to be the easiest process, and we're not going to do all of it tomorrow, but we need to start somewhere, and there's some good roadmaps already on how to do that, and how we can start implementing it on a country level and on a community level going forward. So in terms of One Health surveillance, we really need to look at all these factors. And there was a question in the chat that they asked me to answer. So does this include ecology of wildlife? Yes, it definitely includes ecology of animals, because if you do look at drivers of disease emergence, how can you look at that without understanding biodiversity, without understanding ecology of the species in that area? It's all linked. So it's really looking at this bigger picture. I mean, we're looking in South Africa now, developing these systems, and we're also bringing in animal health into that picture. And maybe not just looking at testing for pathogens, but how can we actually define health of animals, and in that way also determine potential risks of infection. So it's really that broad picture of including everything as per the One Health definition. Thank you.
Great, thanks, Wanda. So the previous question from the audience was, how can we define prevention? So now the question from the Zoom is, how can we define surveillance? So you can see that we definitely need to define the words that we are using. So, and especially, so what's going on in wildlife, because I think it's today is still a black box about what's going on in wildlife. So who wants to start answering that? How would you define surveillance, broadly speaking? I didn't say it was an easy question, but do you try?
So I'm going to just say again, it will depend on the stakeholder. It will depend on the timeline. Surveillance is not a output, but it's actually a process. And I think that's sometimes forgotten, that it's not something that, it's not an end goal, right? It's something that needs to be addressed at several levels, as our colleagues have been describing. So yes, the definition of surveillance is tricky, but it's not impossible. But perhaps Wanda will disagree with me, but that's great. In fact, I do think that there's a role of different definitions of surveillance, because that also allows for different opportunities for funding. And so there is no reason to create one unified definition of surveillance, because it really depends on the systems you're focusing on, because we cannot focus on all systems at once. And of course, that's not at all what One Health means, right? One Health means a coordination and integration. So it does mean that we can have several types of surveillance at different levels, yet different timelines as well.
If I can add quickly, so I fully agree with Anna, of course, and also Wanda. I would like to add as well that, of course, it's a process. I think this was very well put. I would also add the level of forecasting. So, but that was already touched upon by Wanda. That's okay. We talked about, of course, disease surveillance in humans, in animals, but also look at the environment, but then also forecasting specific conditions like weather conditions, loss of biodiversity that could lead to a certain emergence, well, an emergence of a certain virus that we know through research. And now here's the evidence that comes in. It needs to be really well supported by evidence and by what we have experienced in the past, that would forecast what could now potentially happen, so that already before it even goes, maybe it establishes itself in the environment before it goes into wildlife. I'm not sure if I'm going too wild now. But that this, and that is really innovation. I think we are not there, right? But it's the forecasting of that drivers, the co-drivers that Wanda also mentioned, and maybe also including the social sciences, and basically what's happening on Twitter and all the social media, where people are already posting observations that may have no bearing for any other region, but at least it could have an impact on that region where they're reporting the event from. And by that, we can prevent pandemics or epidemics. So I think there's lots to integrate in this surveillance concept. And there's, again, no one size fits all.
So maybe the next task for the HODEP will be to provide another definition of surveillance. So we're going to move to the challenge 4, which is really about data sharing. We already touched a little bit this topic during our discussion, but it seems like it's something extremely crucial, but also extremely complicated. So I will start also with you, Najat, because it's, of course, we think that we are all agree about the relevance of this data sharing, but there is also a lot of technical difficulties in terms of time scale, spatial scale. Some data can be sensitive also, and people don't want to share. They have owners and so on and so forth. So what is your experience about how we can convince people to share data, and how can we do it, I mean, concretely, based on your experience with the Vet Lab?
Yeah, thank you for the question. I think sensitivity, yes, is the word, is an issue. Depends on which data we're talking about, and you know, in Zodiac we started sharing best practices. We started sharing information on how to do sampling, how to build this database, and also you can't force also people to share data, but engage them. Like what I have said at the beginning, we are all in the same boat, and if we miss an opportunity, it can be devastating globally. So from that angle, I think we are talking to to adults and to a responsible population. And of course, we're talking about disease here and pathogens, and during COVID-19, we experienced that issue, and it was a big problem, and I think it's still. You can't convincing it, just being responsible and being yes, responsible and care about the others. But I think for us as scientists, and talking about labs and talking to labs and scientific community and building this network, we can see that there is a willingness to share, and there is a willingness to engage and to network. And I think building the trust also in communities and scientific community is important. Now, there is also political aspects of this, and we're talking about biosecurity. We're talking about other aspects that we need to maybe mitigate. But it's not easy, data sharing, and it's voluntary basis. But and we rely, as I said, building this trust and network is very important. I don't know if my colleagues have other opinion on this.
Yeah. So you want to react?
It's just a kind of case of study, because it come to my mind. I remember in 2012, it was SARS-CoV, same family of the COVID-19. You remember, in Lamech. So the case, one of the problem at that time, we didn't know if it could spread or not. Okay. So just to do the link with interdisciplinarity and common responsibility, because you could have we need a good surveillance, an efficient surveillance, but it means good reaction. Now imagine that the SARS-CoV in 2012 spread a little bit in Europe. Due to international health regulation, you have to take decision. But most of the population at that time affected were Muslim. coming by the make. You need to rely on a strong network of understanding that you are not racist, you are not against the Muslim. You see what I mean? Sometimes you can bring very difficult, hard dilemma. So it's just to take an example that we need to prepare, and we have common responsibility of understanding of the challenges. Of course, we need laboratories. I think one of the lessons also is we forgot diagnostics. It's important of diagnostic for animal, for human, it goes together. And to build local capacities and common understanding, because it's to protect the population. But you know, imagine in Germany, in France, we block the people coming from America because it's a danger. In the media, you have to explain very rapidly, and the media has to be aware before. We have seen for the vaccine challenges. So it's just an example of case studies. We need to work on concrete action, from the surveillance to action for reaction, with, you know, a maximum of understanding.
Yeah, no, that's a very relevant example. Thanks, Bernard. So Anna, so I'm moving to you. So your institute is doing a lot of work about combining these different kind of data for early detection of outbreak. So regarding those difficulty to share data between these different sectors, there are technical difficulties also. So do you think that adding these two layers of environment and animal first is doable, and second is really bringing something relevant to early detection of outbreaks?
So that question is a little bit connected to the previous question that was answered by Najat. So 3 things that are related to human behavior, government behavior, population behavior, which is trust and incentives. In order for institutes, countries, individuals to share data, they need incentives, and it relies as well on a structure of trust to understand whether data will be perhaps used for the common good, like a public good type of interest. The other thing is sovereignty, is the challenge of understanding whether a particular data set does belong to a country, an institution, or an individual, and how these data can be shared in a trusted framework. So that leads to something that we are working on, which is federated learning and federated sharing, which tries to address a sovereignty of data and tries to create trust between partners, between us, between the providers, between the users, in order to create a common understanding of what the usage of these data can be. And best yet, how can we improve these data? How can we improve diagnostics, sampling, to actually create data that don't exist yet, or are perhaps sampled at a scale or any other type of framework that perhaps is not best suited for the questions we have at hand. The other thing that I think I want to kind of highlight is something you were asking, integrating all of these data. I think it's beyond integrating. Oftentimes it's more triangulation of data, because we have to understand that environmental data, wildlife data, livestock data, human data, when they're collected at different scales, and this means geographic scales, temporal scales, because the questions and the design sampling for said data are done with very different purposes. And so that's the first challenge. How do you effectively integrate in one repository data that were created for very different purposes in order to create a common objective of trying to understand disease emergence or disease spreading over time and over space, right? So understanding those scales first is very important. So it's not impossible to link environmental data, animal data, climate data, all sorts of demographic, mobility data, and so on. But it's really the next generation challenge, right? Is what the thing we are now addressing is, how do you successfully integrate such data that actually creates signal rather than noise? So that is the best thing. So it's really kind of overcoming that. Yes, of course, we can collect every data that are available, but it's really trying to understand what is creating signal and what is creating that noise. And so that is the biggest challenge in integrating data across platforms, across systems, across layers of this complex system of ours.
Yeah. Thanks so much, Anna. So Andrea, so I guess you want to bounce back on that.
I think most of it has been said really about how data sharing, and I'm not sure whether my colleague Bernadette Abella-Ritter from WHO is in the room, but what she usually says is, you know, it really needs to be quality data, and you have already mentioned this, Anna, because if it's crap in, you get crap out. So first of all, what is the quality that is needed, and what is the quality that can be provided, and what is the incentive, and what is the system that is used, and how can it be integrated, or I love it, triangulated. I think this was really for me an aha. Wow, that's because we always talk about integration, but this doesn't seem to be realistic or feasible at all times. And then, of course, when do you press the red button, right? So signal and not noise. So which data should go where, and when should be a reaction to send a team, which is also costly, to the ground, et cetera, et cetera. So you know this much better. This is interdisciplinarity here. So I feel already like, oops, going out of my, I'm a neurologist. So anyway, but what I would like to add really is the sharing between the research, because that's my field again, the research community and the decision makers. And what happens really on the ground, and we are just working on a small project. I'm really proud of this project because it's one of a kind. But when we write, so we collect data, the researchers at times very slow, right? Then we analyze our results, and then we publish. And right now the publication process can be up to a year, 1.5 years. It makes no sense. It makes no sense. So we are now working on a digital data sharing platform for early research translation. So it really reaches the decision maker in that country, in that region, but it's not easy because we're facing the same issues: quality, integration, who is responsible, who wants to be informed by which result. But I think it's a first step to see now with the digital translation and transformation that we have to use those platforms to make data available before we publish, but then we are researchers, because if we make it available before, then we cannot publish, right? And then we don't get the credits, and then academia will not be existent anymore. I'm again exaggerating, but we need to have a common understanding of what we should share, can share, and also under certain agreements. So all of this is important, I think. Thank you.
Okay, so do we have any question from the audience or from the panelists? Yeah, please. A quick one, please. I'm the time.
Hello, my name is Beatriz Ismael. I am working on pharmacovigilance, and I am representing the International Pharmaceutical Students Federation. I found really interesting this area of animal surveillance, since it is similar, you can say, as the surveillance of drugs. I was thinking that projects as Zodiac could be inspired in the robust pharmacovigilance system, in the sense that there is a monitoring center, like a global database that can be shared, for example, via electronic format. And also you can, for example, code all the laboratories in this database. You can obtain data, statistics for regions, as per region, severity, type of disease, for example. So if there is a signal in one part of the world and there is the same signal reported in another part of the world, it could be exactly shared. It could be really detected, assessed, understood, and we can act very quickly.
Yeah, thank you. It's exactly that about Zodiac. And we have a portal, Zodiac portal. I think it's Zodiac. It's zodiac.ie.org. And you can go there and you have information on best practices, information on what is on capacity building, individual training and group training, but also data, but data has limited access. We were talking about what to share and with whom we can share. So that's also we have to build this agreement between the laboratories to have access to data, but within groups, and allow certain groups to have access to data. But I agree with you that in terms of surveillance and in terms of a warning system, it's this platform. We have an electronic platform under Zodiac. Thanks.
Thanks. Thank you. So we're going to move. We're perfectly on time. So thank you. So we're going to move to the last change, which is about engaging the stakeholders, decision makers to this target of preventing zoonotic disease emergence. So of course, I'll start with you, Benoit. So engaging stakeholders to prevent zoonotic disease emergence is, of course, crucial. It's a key point. So academic scientists are not always used to understand how to engage with them, right? Because we're not trained to do that. So what would be like your 3 main recommendations about involving stakeholders, decision makers, and civil society in general?
To have a comprehensive framework, because it's, simple for the specialist for research, but not for any common people. So we need a comprehensive framework, and to have somehow NGOs, foundations, business, the private and public together, because we are stronger. So it goes through different kind of forum, like here also discussing about that, because then I think the decision maker or policy maker, they are more convinced since they see, okay, so it's an evidence somehow. So yes, and I think when we started a few years ago, decades ago, to work on climate change, to explain that when there is some population affected by climate change, it brings to, of course, infectious diseases, because we know that people have to move with the animal, and when you move people and animals, it brings diseases usually, and also obesity, because some people have to left a rural area, for example in West Africa, and they move to urbanism, to the city, and they change the way they used to use the food and drink different kind of soda, for example, and obesity. So we have many impacts, and this I think reinforce the research, the specialists with the practitioners. So we believe a lot in this capacity of having research practitioners, and then those who are explaining, and I think we need also the media. Look to the vaccine challenges. We need to prepare, and the specialist of the information somehow to the public awareness in advance, in case, because sometimes you don't know who to trust today. We have so many information circulating, and it's we have false information or real. We have false medicines or real. We have false tests or real. You have AMR, antimicrobial resistance. So big challenges to have a chain of specialists, this is very interesting, but because the politicians, the decision maker, they need rapidly, fact efficiency. So it has to be prepared in advance, a network of coalition of competencies, somehow.
Great, thanks. So Andrea, at a macroscopic scale, so there are many different actions currently on their way. So do you think we have a momentum right now to engage with different stakeholders, decision makers, and so on and so forth, to develop this kind of one-F approach for preventing zoonotic disease emergence?
So you mean a momentum right now?
A momentum, yeah.
Yeah, I mean, the momentum has been created by the pandemic, and that goes without saying. And we need to use this momentum. So, and just to add to what Benoit said, there is a momentum to create stakeholders, also like the private sector. And we just had a lunch discussion, and there is so much already going on. So it starts again by listening what the private sector is already doing. But there are innovative mechanisms, like also banks and investment companies can really come on board. And it is a momentum because of the pandemic, and we don't need another one recurring too soon. Of course, we know there's a quite good, possibility that hopefully there is, hopefully not, we have a new pandemic very soon. So I think the possibility is there for the private sector. Possibility definitely is there also to leverage on the engagement of civil society through climate change actions or biodiversity loss. We should not forget now, I just hear the voices also from our young generation who really, they request One Health education. They request One Health knowledge sharing. When we come in as professors and say, we would like to establish a One Health course or One Health training, very often there is not enough space. So this needs to be created, very radically created. So there is a momentum now that people will listen to when we say collaboration, interdisciplinarity. I hope this gap remains open for a while to be able to create impact. And I would like to close with what I really love is the One Health practitioner. And the One Health practitioner on the ground in the Global South, but also on the ground here in the Global North, where people just know about the One Health approach. It can be a vet, it can be a human doctor, it can be an environmentalist, an environmental specialist. It can be any other profession, but they need to know who to reach out to and how to create this inter and transdisciplinarity. And of course, you need knowledge sharing for this. For the One Health practitioner here in the Global North, I think we need to focus on prevention. And if a doctor sits with the patient these days, the doctor will not be paid for the talking, for the information. And this requires a radical system change. And this is, otherwise there will be no prevention. If it will not be, there's no return on the discussion, on the time, doctors will not have time to inform patients and to create prevention. Especially here in Germany, I can only tell you, like, talking 10 minutes to a patient, you get around 5 to 10 euros. So it's nothing, right? It's just, it needs to be increased. And I think I stop here. One Health practitioners, they go beyond the medical issues. They inform about social aspects of diseases, etc., living conditions, you name it. And this, I think, really goes with the One Health aspect at a local level and also in the Global North. Thank you.
Thanks. Thank you so much, Andrea. So I will have a last question for Wanda. So especially at the international scale, since you are the co-chair of the OLEP. So from your experience from the quadripartites, what do you think could be the key messages to deliver to decision maker, especially at an international scale, about how to involve all the different stakeholders and actors to implement this One Health strategies?
So I think there's a few levels of communication. I think one thing we're not very clear about is so what we mean with One Health. And I think the best way to explain that is by giving very good practice examples. And the Lancet One Health Commission is quite good at publishing some of these in their newsletter. And it's really important that we can show to people what is the benefit. Because why do we all need to work together? There needs to be some benefit going forward. And we really need practical examples and not just talk of what's that going to be. And I think then the economics also become important. We need very good economic models on the advantages of implementing, for instance, a One Health approach. And I think we also need to be much better at communicating some of the success stories globally on One Health. I think the fact that we can talk about a quadripartite is a major milestone. We talked about the tripartite and UNEP for a while, and the fact that it's a quadripartite and the environment is part of that partnership is really significant. The fact that the One Health Global Plan of Action has been released today that was developed by those 4 partners. And this is not just a new plan, it's really bringing all the other plans together in this one document and giving a roadmap going forward. So communicating these success stories, communicating the commitment on a global level for implementing One Health on a national and community level is, I think, really important. But coming with good examples will be the best. And people who's working in this space really need to put it out there and communicate best practice examples to decision makers and the benefits of following these approaches. Thank you.
Great, thanks so much, Wanda. So maybe I will skip the last round of questions from the audience, because I would like really to have a final round of key messages from all our different speakers. So I ask you to prepare something for 30 seconds, but it was actually planned to have 1 minute, because I know that everybody was going to be longer than expected. So I will start with you, Benoit. What will be your key message to deliver after this session?
To take time. Any organization today need to give time to the team to look surrounding what they are doing. We are too much in silos. We know that we need the verticality. We used to say that, but to take time horizontally, we are discussing. So it goes with the governance, and to leave the people also that they are in an ecosystem, what we are doing when we work, and to take it into account. And I agree with Andrea that prevention could be with the doctor, but since the doctor is already busy to taking care, it could be also a chain of capacity to work on the prevention. It goes with this society. So we have to look at not only the medical doctor. He has a responsibility, but we have a common responsibility, and it could be organized, step by step.
Sorry, thank you, Benoit. Najat.
Yeah, I mean, I just echo what Benoit has said, is to coordinate, communicate, and also collaborate. I mean, it's double C. But we need lots going on the ground, and we don't know who's doing what, and we should just avoid repeating. We don't have time, and we don't have money, so we have to coordinate with each other.
Thank you, Andrea.
So I would say we should just, as you said, not give up and continue talking, because by going out into the public, we're going to create this change of mindset that we need. But this is by far not enough. So we need to come to the implementation and to the impact creation. And I think we have already good tools, like Wanda mentioned, the One Health Joint Plan of Action. We also, since a couple of days or 2 weeks, right, we have a One Health Directorate under the DG Santé at the European Commission. So we have structures, we have some frameworks, we have tools from before. We need to implement, and to create impact, and even more than that, and really not forget the ground level work, where the One Health practitioner, not just the doctor, but beyond biomedicine, work together to create this notion together with the civil society and other sectors, and then converging to whatever problem we want to solve. And again, One Health is not a discipline. It's a means of integration. Thank you.
Thanks, Anna.
So I echo a lot of the sentiment here. Perhaps I want to take it on to data. Just understanding that collection of data requires sustainability. Collection of data requires collaboration. So not one organization, not one country is responsible for collecting everything. So like we are thinking about One Health, also understanding that there's collaboration needed between institutions. So Prezod, Rockefeller, all of our colleagues here, right? This idea that one institution cannot solve everything because we all have slightly different mandates. But again, going back to that idea that we can actually organize and coordinate and integrate. And also understanding that there are inherent cycles of data collection, right? And there's also inherent differences in terms of how you define data lakes and data deserts across scales. And those things are often one of the major blockers in truly understanding how you holistically address a problem like One Health.
Thanks, Anna. Wanda, if you're still here.
You seeing me? Yes, I think I also just want to echo what everybody said, but I think it's really important, implementation. We need to, we've got the documents, there's some roadmaps, there's some very good initiatives, we're already all talking to each other. I think everybody is at least talking to each other. It's really now about collaboration on practical level and really implementing what we say we want to do. We don't have time. Monkeypox came very quickly. The next one's going to come very quickly. We can't wait and wait and wait. So it's really implementation and doing it on a practical level, on ground level. And going back to the One Health approach is really essential. We need to not forget about prevention. We need to really look at spillover interfaces. And in a lot of the discussions, this is not prominent enough. And I think we need to be really careful that we're not investing in what I call prevention, in that interface where we need to prevent spillover. Thank you.
Great, thanks, Wanda. Thanks to all the speakers. I think you can give them an applause. So just to conclude this session, so just I've tried to draw some of the conclusions. So there is a clear need, I think, for coordination. I think we said this word a lot of time through the OLEP, through the Code Hepatitis, through all the different agencies and organizations. So we do hope that pandemic treaty and the Code Hepatitis now, which is official, will set up some kind of sustainable tools that could be helpful for this coordination. We talk about also timing. When is prevention in terms of timing? Also the timing we have now to develop this kind of prevention strategies. I think it's really important to use this momentum that we have to draw and to construct the systems that will be useful for the next future. We saw also that a key point is involving all the different actors and probably co-designing the solution with them, with all the different sectors and so on and so forth. That's the only way that we can really have an impact on the field. Another thing, it's a little bit in mirror about what is prevention is we see that control activities are extremely visible because they're in the media. So Benoit was talking about the media, and so this visibility probably allow some kind of a meeting with political agenda. So we have to find a way also to be visible in terms of prevention. And so to this extent, I just want to announce or recall or remember, I don't know if everybody knows that, but so whatever organization and Presod are going to set up a working group to develop indicators to quantify the risk of zoonosis emergence. So everybody, of course, is free to apply. So the application is very straightforward. You can find it on the Presod website. And so I just would like to conclude. We have been perfectly in time, so thanks again to all the speakers. But we hear a lot of time that there is no glory in prevention and in preventing this kind of emergence. So we do hope at Presod and all the different agencies, initiatives, and actors can, I think, change this feeling. Thank you so much for